Hello, my name is Dr. Joe Faraday. I'm a veterinarian here at Brownswitch Pet Hospital. And I'll have people that come in multiple times a week and say, Doc, I need to get my animal shots. Now what I want folks to realize, there are some things that are just as important, if not more important than shots, and that's a complete examination, and what I call a head-to-toe exam on the animals. So what we'll do when folks come in for their vaccinations or for their examinations, the techs will come in here first, they'll check and they'll get a little stool sample, and we're going to check for intestinal worms. And I've got some folks that say, I've been looking at the stool, I don't see any worms, could there be worms? Unfortunately, some of the most dangerous worms animals can get are not visible to the naked eye. It takes a microscopic check to check for them. So the techs will get a little sample, stool sample. They'll pull a few drops of blood in the case of a dog, and we're going to do a heartworm check for that. Heartworms are spread by mosquitoes, a very serious problem, especially down south, but it's starting to be nationwide. So once they get those samples taken, I'll come in, and then what I like to do is I like to start at the head, whether I'm talking about a dog or a cat, and I like to work my way back. And we've got our little volunteer with us today. This is Delta, and she's going to show everybody how we tend to do this. So what I like to do first, when I get an animal in, I like to look at the face and the head and look at the symmetry. Is there any changes from one side of the face to the other? Any types of swelling or something that doesn't look normal? I like to look at the eyes. Is there any redness, drainage? Are the pupils responsive? And yes, dogs and cats have a third eyelid. Are there any problems with the third eyelid? And I can press on the eyes and make the third eyelid show up. Go from there. I like to work my way to the mouth. I like to lift up the gums, or lift up the lips, look at the gums, look at the teeth. Is there much tartar on the teeth? Are there any signs of any growths or masses in the mouth? I like to open the mouth, look in the back of the throat. Any problems in the back, underneath the tongue? Does that look okay? Work my way back. Next we'll check the ears. In the ears, we like to look down there. Is there any signs of any infection or wax buildup? A big problem that we have down south is because of the humidity. So dogs that have a lot of hair in their ears sometimes tend to collect moisture, and that can make them more prone to ear problems. So a lot of times we'll try to keep the hair as short as we can around the ear canals just to let them try to dry out a little bit. We'll work my way back over the body. What does the skin look like? Is it flaking? Are there any signs of infection? Do we feel any masses back here? Any signs of other types of infections or growths? The other thing I like to do too is feel the weight of the dog. We should be able to gently rub our hands over the ribs and feel the ribs. If we don't, there could be an issue with weight. Animals that are overweight are just like people that are overweight. It's not healthy. Next, I'll work my way to listen to the lungs, auscultate the heart. I'm listening for any kind of heart murmurs or any kind of abnormal sounds from the lungs. From there, I work my way back to the abdomen. I like to feel and palpate the intestines. Are there any problems there? Do we feel any kind of problems with the rear of the kidneys that we can feel, or the bladder? Work our way further down, back by the rear end of the dog. Is there any problems around the rectum? Any signs of growths? Are the anal sacs, which sit right underneath the anus, are they full or impacted or having any kind of issues? Start work our way down the joints and the legs. Any kind of grinding or popping of the kneecaps. Like to lift her up. And she's a little female dog. We like to check her little mammary glands. Any signs of any kind of growths or problems around the glands. And yes, dogs can get breast cancers. This is also a good time to check for any kind of hernias. Now, depending on the age of the dog, and possibly if they're going to be going under any other procedures, we may want to pull some blood work, send it off to the lab to check the dog internally to make sure there's not a problem with the liver, the kidneys, and things like that. Once we get the examination done, usually by that time, we can go ahead, we can check the intestinal worm check for intestinal worms. We can do the heartworm check, make sure that looks okay. Now, then we'll do the vaccines. Now, depending on if an animal is an inside animal or an outside animal, or how many animals they get exposed to, that can determine what are the best vaccines to use. We don't necessarily use every vaccine on every dog. It's just whatever they need. So, just wanted to give you some idea today of what entails a head-to-tail exam and why it is so important to have this done on your animals. And I want to thank you for watching.